Hello everyone, how are we all doing? It's Dr. Dami here again. Today I'll be talking about hypertension and salt intake. Is there a relationship? Definitely. Hypertension is the leading cause of cardiovascular disease and chronic kidney disease globally. And in blacks, it is salt sensitive, which means that our intake of salt affects our blood pressure. So when we take things containing high levels of salt, our blood pressure goes up, and vice versa. Unlike in whites, theirs isn't salt sensitive, which also affects. This has impact on the management or the treatment of hypertension for those who have already developed hypertension. For those who are looking into preventing hypertension, it's also important that we reduce our salt intake so that we wouldn't develop, among other things, in order to prevent the development of hypertension. So how do we leverage on this information? So that means we have to reduce our salt intake. American studies have shown that processed or commercialized food items contain the highest amount of salt, form of sodium. So if you're looking into reducing your salt intake, you have to reduce the intake of commercially produced food items, things like burgers, pizzas, processed meats like bacon and the like. So we have to reduce such things if we want to reduce our salt intake. And we have to also start to engage in looking at our food packages for the labels. So usually when there's a package, you find that this is the amount of calorie in this thing, this is the amount of sodium, amongst other things. They're usually properly labeled. So it's important that we start to look at those labelings. As a rule of thumb, the amount of sodium in what you're eating per 7 milligrams should be less than the amount of calorie that per 7 that food item contains. So if you're looking into drastically reducing your salt intake and for it to have impact on your blood pressure, start thinking of plant-based diets. So start to incorporate a lot of minimally processed or whole plant-based diet. It can help to reduce your sodium intake to as low as less than 1,500 milligrams per day, which is fantastic. This is good for those who are looking into preventing hypertension and those who already have hypertension, in managing it or even reversing it. So healthy lifestyle is the way, healthy habit is the way, eating most of the time plant-based diets is the way, restful sleep is the way, engaging in physical activity is the way, engaging in positive social connections is the way, and stress management is the way. Have a good day.